Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin. Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
Welcome viewers to this week's episode of Health Watch on Advent Cable Network Nigeria. I am Angela Nweze. All parts of the body are very crucial for effective living. There is a proverb that says that the eyes are the windows to the soul. This means that with the eyes we communicate deep emotions. The eyes are critical because they enable us to carry out diverse activities and be productive in our daily responsibilities. The effect of poor eyesight can have a devastating effect on family and pose an economic burden on the wider society. Personally, I feel the eyes are one of the most neglected part of the body. Let me give us some statistics. A 2007 clinical and epidemiology research on the prevalence of blindness and visual impairment in Nigeria found that approximately 1.13 million Nigerians 40 years and above are blind. A further 2.7 million adults 40 years and above are estimated to have moderate visual impairment, and an additional 400,000 adults are severely visually impaired. Now, this study was carried out in 2007, and that is about 13 years ago. As the population ages, even if the rate of age-specific vision impairment remains constant, the number of visually impaired individuals will increase significantly. Personally, I want my eyes to serve me longer before it gets weakened. So can we do anything to make our eyes serve us longer? If there is, how? Today, we shall discuss care for the eyes. My guest on the program is Venerable Dr. Louis Oche. He's an optometrist with the Health and Human Services Secretariat at the Federal Capital Development Authority, Abuja. You're welcome to the program, sir.
My pleasure.
Thank you for coming. So we're going to talk about the eyes today, and it's such a pleasure to talk about it. I really want my eye to serve me. I don't want to wear glasses.
So
I want my eyes.
So you do the needful.
Yeah, I do the needful. So I want my eyes to carry me for a very long time, and I hope, and I know there are viewers that are watching and actually want the same thing. So we know the eye is just for seeing, looking. So what are the functions of the eye from a professional, not from somebody who's just like me?
Well, just as you said by way of introduction, the eye indeed is the light of the body. You find out that once the eye goes down, it's like everything shuts down on the person. And so primarily is for you to see, but again, your emotional stability is a function too of how good or how sound your eye is. Because you find that the man who is seeing very well can evaluate properly. He can do his things. But once vision begins to drop, his sense of fulfillment begins to drop. He feels incapacitated.
That's true, actually.
He needs someone to help him or her do what he or her wants to do. And so there must always be an assistant. So he or she begins to feel, oh, my life is coming to an end. And so you find that people, the wise person will always ensure that his or her eye is intact. It's not just to see, but to help you have a sense of fulfillment, and to help you be able to be socially responsible too. So you need your eye to be there. It's not as if the other organs of the body are not important.
But this carries all of them.
This carries all of them.
This carries all of them.
You know, the scripture will say the eye is the light of the body.
Yeah, the light of the body.
It's the light of the body. And truly, when you evaluate it, you find that it is. It is.
Oh my God. I want to have sharp eyes at 8.
There are some things that will make one's eyes to be that sharp.
Yeah, longer.
When I mean sharp, quotes, in quote, as in you are still seeing up to that time. Maybe perhaps in the course of our discussion,
yes,
we'll
talk about
those
how
ones.
you can keep your eye that long. I really want to know about that.
All
okay, now the statistics. It was really difficult to find the position of Nigeria and even some states in some countries in West Africa on what the number of visually impaired people are. It's really, it's not a lot out there. But what's your experience like, daily? People come into the hospital. What kind of visual impairment is more prominent in this part of the world, with your experience and of course with other experts that you work with?
Well, it's unfortunate that in this part of the world we don't keep records.
Yeah.
We don't keep records because record keeping helps in planning. It helps in planning. Now, I wouldn't be able to tell you specifically that this is a number for so and so year, and then break it down to say this state has dates, this state have dates. It's more with a particular sex, as in male or female. Is more with a particular age group. We don't have a record for such. But just as you said, I can give you an overview of what happens or what we have there. It's pretty high, especially for cases of cataract. Issues of glaucoma. We're beginning to have an increase with issues of conjunctivitis. Yes, that there.
But I thought conjunctivitis is the one, the reddening of the eye, and the one we call Apollo.
Yeah, it's not exactly the one we call Apollo. But well, for the layman, throw it there and see Apollo. It's there, but that's not exactly the Apollo. You see, but the eyes are red, steering is discharging, stuffs like that. It's there. And then we're having an increase in computer-related eye problems. Records are there. Eye strain as a result of use of the computer. And the answer will be far-fetched. We're having, among the young people, we're having more people who are using the system. Virtually everything. In fact, with what we have on ground now, the digital is the way to go now.
The way to go now, of course.
Is the way to go now. So we're going to have more of that. And what the doctors, the eye doctors, are thinking of is, how do we address this? By way of counseling, because first you need to diagnose, and then you treat. In treatment, we're talking about, apart from just giving drugs, we can counsel. Apart from giving drug, apart from giving glasses, some of them you can counsel. And if time permits, we're going to look at that, because it's becoming prevalent now in the offices among different age groups. It's not just for the young, because those in school, these young ones are using the system, the iPad and all of that, and there's some iPhones. In the offices, it's computer all the way. So, and the people sit down there doing their work. And for what we have now, people are going to spend more time using the system.
Yeah, because I can't remember when I really wrote properly on the paper. It's always just type it
the
in
system
and let it go.
So people are going to do a lot of work using the system. It means they will sit down there, and part of their problem is using that system. So it's not about, oh, take this drug. You can't be on drug through. There are a couple of things we could talk of. Computer shield.
That
you could talk of the glasses he's going to use. A UV protective glasses, a photochromic glasses. We can equally think of the counseling, and the counseling will take us to what I call the 20-20-20 rule. The 20-20 rule is to say you are using the system, look at the system for 20 minutes, look away from the system at an object that is 20 feet, just for 20 seconds, then go back to your. So it takes away eye strain. 20-20-20.
Okay, I know we'll talk about eye strain, but I think I want to hit on this now. So you, after looking at the system,
let me repeat myself again.
Yes, sir. Please go ahead.
I'm saying the rule of 20-20-20.
Okay, 20-20-20.
Yeah.
Okay.
The first 20, this rule of 20-20-20 is computer strain, eye strain, to take it off, wave cancelling. Look at the system. You're using the system for 20 minutes.
Okay.
Take your eye off the system. Look at an object or something off it for like 20 feet distance.
Okay, something that is far away, 20
Anything
feet.
for
Okay.
just 20 feet. It's just like you take your eye away for 20 feet, and then just for 20 seconds, and you're back again doing your work. So the 20 seconds, the time frame that you just used to look at that thing as 20 feet, and then you come back into it. So with that, you relax the eye, the strain, because when you're on it, the short wavelengths enter into the eye, and then it makes the muscles to contract. And so the strain will be there. But the individual is in the system doesn't observe it early, because it's something he's doing every time.
Every day, yeah.
And he wants to finish his work. If the person is unlucky, the boss is on his neck. You must deliver this so and so time. So he doesn't want to give a break. But he's doing a disservice to the eye. And so we are saying 20 minutes, 20 seconds. You've not lost anything.
You've not lost anything, yes.
And you've helped your eye to be able to finish well than for you to stop halfway. So do a 20, while you've been reading, writing your thing, or whatever you are doing, make out 20 seconds to just look at something, and then you come back again, you relapse it. So intermittently you are doing this as you are doing your work. Relapse your eye, and you can finish well.
Wow.
It will save you all those eye strain, the headache, the redness,
because
the
I noticed that as well last year. I did a lot of computer work, and then at a point in time, I noticed that my eyes were so tired. Even when I wake up from sleep, I'm feeling tired, with the eyes. So I wasn't taking out any 20. I was just.
You just want to
hours upon hours.
You want to get it done. You want to get it done, but you finish your work, but you've caused a lot of discomfort to your eye.
Okay.
If after that you had so much again to do, I'm sure you will ask for an excuse. Oh, please, just give me some time.
Okay.
But if you are doing this that we're saying, you can comfortably run your work without any stress.
Okay, that's a good one. 20 minutes. Then you take your eyes for 20 seconds, because I'm the 20 feet, then return.
That's it.
Okay, I'll put that into. So let's talk about, I'm glad we've just talked about the eye strain, the computer. And this applies to phones?
Yeah, to phones, to phone. People are using it.
Because phone is just...
it's so close. Again, we have, that's counseling, where counseling comes in again. People are, permit me to just do something. People are good at, they bring it so close.
Yeah.
There's a distance that you must maintain. You shouldn't be too close. You shouldn't be too far.
Too far, okay.
Well, you find that for myopes, those who don't see things that are far, for them to see, they bring it so close.
Yeah.
But when they are corrected, they put it at a proper distance. You understand? But the point is, don't bring it too close. When you bring it too close, you are straining the eye. There's a distance. You just maintain this distance to be able to read whatever you are reading. But people, they enjoy what they are doing. They forget the near distant part. So they bring it so close, and so before you know it, they have the eye strain and the pain. The eyes are tired. But they keep doing it. And some keep doing this thing without even blinking.
Wow.
Because as you are doing all of this without blinking, the eye gets it dries up. It dries up.
Yeah.
So it's important that as you look at these things at near, whatever you're looking at near, whatever this thing, you just blink.
Okay.
You just blink. It helps wet the cornea, the black part of the eye.
Okay.
So you wet it, then you continue your work. Because for all of these ones, they emit the short wavelengths that are quite harmful to the eye. So it dries, and when that happens, that's when people tell you, oh, it's as if there's sand in my eye. My eye is red. Oh, I have tired eye. And then the person is touching the head and is trying to do it. All these are things associated with.
I really like what I'm hearing now because of the screen. Because these days we do everything on the phone, we do everything on the computer.
You can't stop it.
So we need to find a way.
Yeah.
It has to be deliberate. It has to be a deliberate.
Just a bit deliberate.
It has to be deliberate.
We keep try and put what's it called, shield on your the computer. But when you don't have it, make sure you do all of these. Or if somebody who is wearing a prescription, you make sure that is an what's it called? It has an anti-reflective effect on it. A photochromic effect. All of this takes away all these strains that yes, the individual will have.
Okay, we'll go on a quick break. When we come back, I want us to talk on glaucoma. We'll talk about all those cataracts and co. Just touch on them and walk around them. We'll be right back, viewers. Welcome back, viewers. Before we went on the break, we were discussing care for the eye, and if you've missed that part of it, we'll just do a little recap. So one of the 20-20-20 rule. So to prevent eye strain. So you look at your screen if you're working on the computer. If you're working, you look at your screen for 20 minutes. Then you take off your eye from the screen. Look at it
20 feet.
20 feet
for
and
20 seconds.
For 20 seconds, and then you go back to the system. Simple rule. It helps you a lot to keep your eye safe for longer. And my guest is still Venerable Dr. Louis Oche. Thank you very much, sir.
Thank you.
We are learning a lot today. Okay, so we want to talk about visual, defect. I know there's cataract, which seem to be very prevalent here. How does it work? How do we get it? What causes cataract?
A couple of things cause cataract.
Okay.
But first, let's throw a little light into cataract.
Okay.
Because we see people come to hospital, and some people will tell you, so they say I have cataract. You've not seen the person. They've concluded it's cataract. And then by the time the person now comes explain, it will just be a growth in front of the eye. That's not cataract.
Okay.
What they are presenting is what we call pterygium. But that's not cataract.
Okay.
The truth is, because it's the commonest eye defect that everybody. Once you have an eye thing, people say cataract. But actually, what cataract is the hardening of the lens inside the eye.
Okay.
There's a lens in the eye. Now, when you are looking at some of the light once enter into the eye, the passage is from the cornea, the black part. They will call it the refractive pattern of it. The cornea, the lens. The lens help contract it, convert the whole thing, so that it forms an image on the retina. Now, the lens is inside, is transparent.
Okay.
Now, what I mean by the word hardening, that's what I want to explain, because I use the word hardening. What it simply means is that over time, I'm talking about the H type. Over time, the transparent lens begins to lose its transparency.
All right. Okay.
Let me break it down to a layman's way. It's like raw egg.
Okay.
It's clear. Once you now cook, it becomes white.
Okay.
Hardens. That's exactly what happens.
All right.
So with age, that transparent lens in there hardens.
Okay.
Light can pass through again.
Okay.
Do you understand? That's the one we're talking about, age-related.
Okay.
But the other things that could cause cataract.
Those ones happen naturally. Just a natural process.
A natural thing.
Okay.
But you have the one that we call it traumatic cataract. Something hit the individual.
Oh, okay.
And the lens got affected.
Okay.
Perhaps this person is working in a factory, and as he's using the thing, and he hit the eye. So the impact on the lens could make a transparent lens not to become transparent again.
All right. Okay.
So the person has cataract, but he's not old.
All right.
Part of the occupational hazard. So the job have predisposed him to having cataract, not because he's old. You could equally have cataract. There are many types, I'm just trying because of time. We equally have the one we call the congenital cataract.
Okay.
This person is born with it.
You're born with cataract?
He's born with cataract. We call it congenital cataract.
Yeah. Wow.
in that case, part of this thing is that the child, the baby, the fetus, at the moment of development of the organ, the eye organ, this thing, either this thing, the mom took a particular medication that is contraindicated for that time.
So during the formation of the, are you talking about the congenital cataract?
Yes.
Okay. So during the formation.
Yes, formative age of that, yes, referred to this thing. The eye, that is the eye at that time, that drug affected it.
Wow.
So it's born with that.
So
that's why in hospitals, there's doctors wouldn't advise a pregnant woman matter this, so you don't just give drug. You don't just give drug. As much as possible, you counsel, or you just keep based on the vitamins. You understand?
Yes, because anything you take that is not
anything you take,
even if it's not the eye, it can actually affect something else.
It could, yes.
Part of the
We've
body.
had children born and they've lost the ear hearing. They can't hear. You could have the ones that the hands are deformed, something deformed. So you must be very careful.
The wrong men. Okay, you know, just to dwell on this a little so that we communicate to people that are watching. You know, so even at that, you know, the people who take herbal medication, you know, some people recommend just fly it from some other country for you and say, take this, it helps. That's what they give in this country. If it's not prescribed by the doctor,
don't use it.
Don't use it.
Don't use it. We just say don't use. Don't use. Some of them, you say that Mrs. A or Mr. B took it when he or she had something. Doesn't mean that's exactly what you have.
All right.
And doesn't mean you should take it. See your doctor. Because your doctor is going to clerk, is going to have your history and know whether you need to take it or not. So some people say, no, but my friend took it and it got well. You can take it and then you have problem. You could have a problem. So you could have, let me not digress.
Exactly. I just wanted to,
you know. So you can have that congenital type. You can have, I've mentioned the one of trauma. You could have the one as a result of a chemical burn. That could cause, So, but majorly, what you have in the hospital there, you have the congenital, you have the traumatic, and then we'll have this
the natural one,
which is age-related. That will have, the cataract. So it's quite common. Hardening of lens. It's quite common. In this part of the world, and the issue is, it's common, and perhaps maybe why we will have more of the age-related type is because of the tropical part of the world where we are. The sun.
The sun, all right,
The sun. It's a big factor to that.
So because of the lots of rays that are coming,
the infrared rays and the radiations that we have, so it predisposes the person, the African, more, African American more because of family history. If the African American family history, they will have it much more earlier than the Caucasians.
So just to talk on that. Because we have a lot of sun, I mean, this season is even better, this rainy season. I know the beginning of the year is excruciating. Is it advisable to wear some form of sunglasses, or does it help?
So what you are taking, what we want to look at now is like what you need to do. That's what you're asking us, like what you need to do to ensure that you are eye is good, just as you said by way of introduction, then that you want to enjoy your eyes you want to enjoy your eyes on through. So it will be, what are the things that you need to do to ensure that your eyes are okay. Humanly speaking. Well, one is you need to eat healthy.
That one.
You need to eat healthy.
When you say healthy.
What I mean, a balanced diet.
Balanced diet,
You know, when we say this, some people would say, in this hard time, this is but the truth is, it's not expensive. It's not expensive. We should delete this thing in our head that healthy means
expensive.
Big restaurant, expensive. No, it's not. It's not. little money, you eat healthy.
Yeah.
It's about fruits, about vegetables. And the truth again is that God has blessed us in this part of the world with a lot of these things that are, quite good for the eye. You know, the fruits, the vegetables, the carrots,
yes.
and all of that. Like fish, omega-3, fatty acids, salmon, tuna. These are quite good. And this is not too expensive. Not too expensive. So the food itself, the little money you can get is eating right.
Right.
It's not about the quantity and other, it's eating right. And to try as much as possible for any season, the fruit that is there, devour it. Take a lot of it.
Yes.
Take a lot of it. So eating right is very important.
Okay.
Another thing that helps with the eye is the exercise.
Okay.
Into exercise. People think that exercise is just only you want to keep fit, you know, and that's it. But the truth is far beyond losing weight.
Okay.
The entire body is connected. A person who is fat, not fat, let me not use the fat, don't be obese.
Obese, yeah.
A person who is obese, most likely will be diabetic. And diabetes have a great impact on the eye. You understand? So diabetes will be there, cholesterol effect will be there. So the exercise helps make the eye healthy.
Okay. So which means exercise is not just
exercise is not just about running and yes, I have power. I have no.
It works everywhere.
It works everywhere. It works everywhere. Blood circulation it's quite high, normal, just okay. The eye it's doing it well. What the body doesn't need is just off it, and so it's quite there. Because the truth is, diabetes have a strong impact on the eye. Diabetic retinopathy.
Yes, retinopathy.
So the person vision is blurred at all times, and so you tell you, I'm not saying it's like they smoke stuff like that. You are not exercising, healthy again. Hypertension, the BP comes up. BP have a significant effect on the eye. Hypertensive retinopathy too have an effect on the eye. So, and it's none of them is good, but it's so bad when an individual have the two. You barely come out of age with a good sight. Even one, it's damaging to the eye. Not talk of when you have the two.
Wow.
So exercise is very important.
And eating healthy as well.
Eating healthy is very important.
Stay away from
the
diabetes, hypertension.
Yes, hypertension into that. Okay. Again, it's important that you wear sunshade.
Okay.
And that takes me back to the cataract thing that we talked of. You know, when some people wear sunshade, people will say, he's doing guy, he's doing this. It's far beyond guy. You are protecting your eyes for a couple of things. One, the sun wouldn't enter. Two, dusts.
Okay. That's true.
Wouldn't enter.
That's true.
You know, I mentioned something earlier about pterygium. When people say cataract, that growth, you know, from the white part of the eye trying to encroach into the cornea, the black part of the eye.
Right, yeah.
It's as a result of dust, sun, and wind.
Oh, is it?
Yeah.
Oh,
it's not as if something hit you. I don't know. It's as a result of exposure to dust, sun, and wind.
Which is which is a lot here.
A lot here. And it's much more prevalent in the lives of people who are living in an area like up north, an area where you have a lot of sun, dust, and all that. Desert area, you have it.
Oh, wow, okay.
You know, so it's one of a sign a doctor will use to know, oh, this person where he's saying is dusty.
Dusty, okay.
You see it going, so it's there.
Okay.
So sunshade is not putting your glasses in photocopy. It's not guy.
Okay.
You are protecting your eye.
Okay.
So sun doesn't enter into the eye.
Okay.
At the same time, the dust, the wind doesn't have access into the eye.
Okay.
We're not saying it has to be a screen thing, but we're saying put on a sunshade. I mean, not to be too large. You know, not to be too large. Because people will say, how big does it have to be so that nothing enters? No, just a normal sunshade that you wear. So that as you move, whether in a vehicle your vehicle, because some people, it's not every time you put on your air conditioner in the car.
Of course.
You're on just to put in a place where they use bike, keke, this thing.
Yeah,
so it doesn't enter.
It
keeps entering. Yes. So it's important. Put on your sunshade. If you have your prescription, your glasses, put on your glasses.
Okay.
It helps shield your eye from that.
Okay, we're going on a break. Waiting on me to go on a break. But so we're going to go on a break now, and when we return, we'll still continue talking on how to care for the eye.
Okay.
But I also want to let our viewers know that we're going to be bursting some myths.
Okay.
Is it good to drink Gary? Does Gary affect the eye? We're going to kill that myth today. So please don't go anywhere. We will be right back.
Did you know that you can do more to protect your eye health? Meet Jane and Carmen. They've both been wearing glasses since they were teens. Every few years, whenever Jane noticed changes in her vision, she'd look around for a random optical shop offering the best deal. At the shop, she'd have a standard refraction eye test by a salesperson and get a new pair of glasses. Still, her vision kept getting worse, and she started noticing other changes in her overall health. It wasn't until she saw a medical doctor for other health concerns that she learned she has diabetes, and her vision problems are a result of a complication known as diabetic retinopathy. Unfortunately, Jane's vision loss couldn't be reversed. Imagine the impact that has on her quality of life. Jane shared her story with her friend Carmen. Carmen might have gone down the same path too, but she learned from other friends that a simple vision test wasn't enough. So when it was time for new glasses, she went to a professional eye care center to receive a comprehensive eye examination by a registered optometrist. The examination revealed early signs of diabetic retinopathy, even though Carmen noticed no other signs of diabetes. Thanks to the exam, Carmen was able to seek preemptive treatment and prevent any further vision loss. And she has a wide selection of frames to choose. Good call, Carmen. Getting a comprehensive eye exam gave her more control over her vision, health, and quality of life. And now Jane, too, is getting the comprehensive eye examination and proper eye care she needs. So why was Jane's initial experience so different? Jane received a simple refraction test conducted by an optical shop salesperson who found the prescription Jane needed to quickly improve her vision. However, the comprehensive eye exam Carmen received by a registered optometrist offered a more complete picture of her eye health. In addition to diabetes, a comprehensive eye exam also can help detect high blood pressure, high cholesterol, and other eye diseases like glaucoma well before their symptoms become apparent. While a comprehensive eye exam is not a substitute for regular checkups, it should be part of your overall healthcare checkup routine.
Welcome back, viewers. Before we went on the break, we were discussing care for the eyes, and as I said, still stay with us to the end of the program. We're still going to be busting some myths, that you believed about your eye. And my guest is still Venerable Dr. Louis Oche. Thank you very much, sir.
Thank you.
So I just cut you off then when we were talking about the care. So we've talked about eating healthy.
Yeah.
We talked about exercising, very important.
Yeah.
Since some people just think exercise is to lose weight, but it goes all around.
Yeah.
And we know that diabetes and hypertension have great impacts on the eye. Then we also talked about wearing shades, especially for this region, to prevent dust and sun and wind. So the glass is not just for guy. It's good we wear it. It helps a lot in this region, especially for glaucoma.
Sorry, for the cataract.
Well, cataract. You said was wind.
So you always put on your this thing. So then I to talk on. I said, if for those again who are working in the kind of work.
Okay.
For example, I want to bring it down. The welder.
Okay, where you have that, that brings that.
Light, flicks on those metal thing, light thing. Yes. I think because it's just our level of literacy or whatever. I don't know what to say. We don't seem to, a good many, and they don't seem to know the importance of these things. In the hospital, I remember a couple of years ago, I was in a rural hospital.
Okay.
So I saw a lot of this. They come in every day. The welder, it's welding, and he's not putting on his goggle. So once he does the metal, we go in. Yes. And we've had many that, Africans, black men, they're so strong. With that irritation, some carry it for 1 week, 1 month. It's when it becomes so bad and they can't see, they come to the hospital. And it's so easy to know, because even when as they say, no, I'm wearing it, but when you find that this person is not wearing anything, because it's just on the central part of the cornea that the metal, went in. So that.
And even if you're around there, apart from the world,
try not to, except if maybe they're doing your job and you want to direct the person, then wear something.
Okay.
Maybe you want them to fabricate something for you and you want to direct them, maybe you're the professional, you want to direct them what exactly you want them to do. Please put on something.
Now, a piece of metal in the eye, that's a huge damage.
Well, some are really bad. Some are not too bad. But the point is, it has caused, some have caused some laceration, a big cut on the cornea. Some it was just only an abrasion, so you just know that, oh, there's something there, but it's just like a scratch.
Okay.
Now, if the patient comes in early, you can quickly remove and treat.
Okay.
Some that didn't come early and feel, when it happened, if we take palm wine, put in the eye, or if we mix this thing, we put that there is one agbo, if you put inside the eye, it will clear. So by the time they come, the eye would have been so infected. So when you remove the metal, usually mandatory to remove the metal from the eye, and you treat the infection, it will leave a scar. And the scar, the scar will definitely affect the site. It's a function of where the scar is. If it's on the center, it will grossly affect the site. If it's by the side, it will affect, but it will not be as much as that of the center, the central one. Yes, but take it or leave it, vision is going to be compromised. So, and at times, it's among the young ones. Those who are wearing the young boys. So imagine 18, 20,
still
25, 30,
learning from the father,
and then you've lost your sight.
At that age.
And some could have been maybe the left one, and before you know it, the right one. So we always advise you. And the funny thing is that they have it, but they feel it's waste of time.
Waste of time.
Waste of time. So we are saying this so that let's educate our people.
So if you're doing anything that has to do with it close to your eye,
yes,
your
job, yes,
your job, especially,
your job is there. Please put on something protective.
Even some of those people who nail things.
Nails, I remember again when I was in I think it was in Asokoro Hospital that we had that experience. The young man, they told them to come and remove, do some maintenance in the house, and so he was trying to use his pinches to take out the nail, and it came out and hit the eye. The truth is that, yes, he was treated, the pain was excruciating. He lost the eye. No, he lost it.
Oh, dear.
Yeah, because he wasn't anticipating
that it would come.
So he pulled it with force, and he hit the eye. That's even occupation. We even have some domestic...
at home?
Yes, at home. No, some. I've had one, but that's of my profession. I've had one. The person, what was he doing? Trying to open a bottle of Coke.
And
so we'd open that. So he just opened it and he hit the eye.
Oh dear.
Yes.
Wow.
So it's there. So we need to be very careful.
Deliberate. You have to deliberately be careful.
You must be
about
careful.
The eye. Okay.
In fact, yesterday I noticed in someone that I went, the toothpick, there's a button you press and the thing will come up. Yes. So when I pressed, the pick just came out. Yes. But because I've been conscious of it, don't bring anything close to your eye. So I had to speak to them and say, I imagine if it's
somebody
someone
who just put the eye there and pressed it and that's it.
So try as much as you want to bring things like this close to the eye. Again, thing to remember, find out.
Okay.
You have some family-related eye challenges.
Okay.
You find out that maybe in my family, people usually have this blindness. If you check, oh, my grandmother was blind. Oh, my mom, for instance, had this eye issue. Find out why. Some of them, you find out it may be, as we are saying, diabetic retinopathy, hypertensive retinopathy, it could be glaucoma, this thing. So, to make sure your eye is healthy, check early.
Okay. So if
regular
you notice
checkup.
this thing, if you notice this pattern.
Before you even notice it, yes, when you know, oh, my family, this is what used to happen.
Okay.
Form the habit of checking your eye regularly.
Okay. Okay.
Check it regularly. Your eye care provider should be able to tell you how often it should be.
Okay.
Because it depends on the age, race, and all that. To know, oh, but you have to check your eye every month.
Okay.
Check it every 2 months. Check it every 3 months. Check it twice in a year.
Yeah. Okay.
So the eye check help nip it on board early.
Okay.
There's some eye visual impairments that could have been nipped on board much more earlier if the check was done. Yeah, but some of them will tell you, you know, so tell it's not my portion.
It's not my portion.
Some will tell you it's not my portion. It's not about not being your portion. It's not about not being your portion. Do the needful. Check your eye.
Check your eyes, yeah.
Nobody wants it. There's nobody that will tell you it's my portion. So if you don't want it to be your portion, visit your eye doctor.
To check.
Check your eyes. Oh, how good is my vision, my visual acuity? Because when we're talking about checking your vision, we're talking about checking the visual acuity, and then we're talking about the peripheral vision.
So acuity is the distance?
Acuity is the distance.
Distance you can see, okay.
At 60, what am I seeing?
Okay.
So you go to the check, so, oh, you close your left eye, we check the right eye.
Okay.
How far you can see. You close your right eye, we check the left eye. You open both eyes, we check how you are seeing with both eyes.
Okay.
That's it. Then we're checking, that's a visual acuity on how good you are seeing slowly. Then we now have one we call the, what's it called, the peripheral vision, central visual acuity. What we are doing in that central visual acuity, we're checking to see the entire eye.
Okay.
How good is your vision when you are looking straight and something is happening by the side?
Okay, if you can.
You mustn't turn your head.
Okay.
You are looking at me, but if something happens by your right side, you see it. Left, you see it. You don't necessarily have to turn your head to look at that.
Okay.
So what that vision is, that one is doing is to check the entire periphery. How good is your sight peripherally? Okay. So it's not just to say, oh, I'm seeing far. Oh, I can see this. No. We're put on beyond that. How good is your vision peripherally? Because part of glaucoma, which is
no, carry on.
Because part of the things that happen with glaucoma, even though you say we're going to talk on that, is that when glaucoma gets to the end stage, almost close to that, a very bad one anyway, before to the end stage, the individual is seeing. You tell him to read, what he's seeing is able to, not too bad, let me not use the terminal one, it's bad, but not too bad. But this person is seeing, but what he's doing is, we call it tunnel vision. It's only the central parts that he's seeing.
Okay.
Anything by the sides, he has lost it.
Wow.
So the family members may be carried away to say, I bet he's seeing. They think it's, yes. And the vision is just contracting, he's losing it. He's also only the whole, the pin of tunnel vision, just only there. He could read it, but anything side, the whole of the periphery around it, it's gone, it's compromised.
You know, sometimes helping me, it kind of, I'm trying to thinking if most of the people who drive have that peripheral issues in their vision. Because sometimes when you see the way people drive, they don't even, as if they don't see. And then when they turn, they're wondering, now, there's somebody, you know, next to them.
You know, that's why we've talked of it severally. That, and thank God, I think the road safety is doing that. That for you to get driver's license, you need to be checked. Because you see, when good vision is not, as I mentioned, it's not just about seeing.
Yes,
your sights. Now, the back of it, there's a point that we'll call the blind spot. At that spot, no matter whatever gets to that spot is not clear. You're not saying it. That's why it's a blind spot. But after it, you will see. You understand? So when the object passes it, it's clear you can see. Pre-post you can see, but on that spot, you're not seeing anything.
Oh, I see.
So we will not say that. So you see somebody who are driving, they feel comfortable. Oh, I've looked at the side mirror or looked and I'm okay. No. Haven't checked that thing, you're still going to look back to be sure. Because if the car that is coming, as of the time you felt it was okay for you to veer off or overtake, this thing, if that car is on the blind spot, you're going to have an accident. So haven't checked, oh, how good is it peripherally, still just because of what you mentioned. Be able to look and see, oh, no car is coming. Then you go ahead and do what you want to do.
Just to be sure, though. Yeah. Wow, that's a lot we're learning today, honestly. And so when you find out, of course, when you find out about, some eye defect, the obvious thing is to go to the hospital. But here's the question.
Okay.
There you have the ophthalmologist.
Yes.
You have the optometrist.
Yes.
And you have the optician. And there's a difference in the three of them.
Yeah.
And many people don't know the difference, which is strange. So if you can help us, who do you go to when you find out that there's a problem with your eye?
Okay.
And what kind of eye defect? This is where we'll wrap up. Then we'll go do debunk our myths.
Okay.
So who is doing what?
Okay. There are three personnel, so to say, or individuals in the eye care. Two of them are doctors.
Okay.
The other one is a technician.
All right.
You have two of them. There are three people. Two of them are doctors. One is a technician. The ophthalmologist is a consultant.
Okay.
He does the surgery about the eye. You have those surgeries, those major surgeries of the eye. He does all of that.
Okay.
Now, the other doctor in the eye care is the optometrist, who ensures all of these things you've asked me. That's his work.
Okay.
Examination, diagnosis, and treatment of eye care, of eye visual impairments of this thing.
So that's basically who you're going to, who you're looking for.
Yes, because he's the person who examines and does all of this. And when you now find that, oh, this person is going to be operated, he needs a surgeon, someone to operate him. So he makes that referral to the ophthalmologist who will operate.
Okay.
Now, when you have this other, there's some other minor ones treatment. The optometrist will treat with drug, do the drug treatment. Some of those minor, I can tell you those things enter the eye to remove it. He could do that, that.
Okay.
Now, the optician is the technician who fixes the lens.
Okay.
So when the optometrist gives part of his work, he will give drug, he will give glasses, he will do the counseling and all of that. The key person there in the eye profession is the first contact person.
Yeah, okay.
He's the first contact person who will then make the referral out. Okay. Oh, this one we are going to see the ophthalmologist who is going to do that surgery for you.
Okay.
Now, for the glasses, that's where the optician is.
Okay.
He's not a doctor, he's a technician.
He's a technician. He doesn't need to go to medical school.
He doesn't have any business in medical school. His business is just, you just tell him, this is a prescription, this thing, give him this thing. His work is just to cut that lens, put it in the frame, and return it back to the optometrist, who will check to be sure that that prescription is correct, and then dispense it to the patient who needs that.
Okay.
Because it's not every patient that needs glasses. Some need it, some need drugs, some need to be counseled.
Okay, just to fix, just as we've talked about.
Yes.
Some of the things we're really running out of time.
Okay.
This discussion is so interesting that I wish I had more time to talk about it. So now we've distinguished it, because I really wanted to do that, because sometimes when you say, we went to the eye doctor, and you just say that it's an optician, and then they say eye doctor. I'm like, no, there's a difference. So I wanted us to just clear that, just in case
the
someone
two doctors, the optometrist and the ophthalmologist.
Okay, so let's debunk some myths that it's been going around about the eye. Okay, we talked about eye exercise. They said it improves vision, right? You agree with that? That's true.
Yeah, very true.
So what kind of exercise do we do? you know,
Okay.
do you bring
There are a couple of exercises that we could do. We have, I mentioned to you, that one I talked about the eye strain is like an exercise too.
2020.
Yes, we equally have the one of the pencil push-up. You bring a pencil like a biro that you have. You bring it closer, keep bringing it just to the nose bridge. Your nose bridge, yes, straight onto the nose bridge. So you keep looking at the tip of your pens, of your biro, you keep bringing it, you keep bringing it, you keep bringing it, you hold it to me, you bring it. When you've run out again, you begin to push out.
Okay. At the point, I don't know what I'm saying.
Yes, you look as if it's becoming double. Yes.
Yeah.
After one again, you do that.
Yeah, you do that.
You're pushing push-up method, the push-up method.
Okay.
So you are training the muscles of the eye.
Oh, okay.
Muscles of the eye.
All
we
right.
equally have the what do like the H thing too. So you tell the person, okay, oh, you move your eye up, you take it, say move it up, he moves it up, he's moving. You say, don't follow the pencil. You're telling the pencil or biro.
Okay,
You say,
just
so you say, keep looking at it. So you say, keep looking, don't look at, keep looking at the pencil. So you see the eye, the muscles, the superior rectus muscle, they're moving up. You're checking the muscles. So the other one, they feel, it begins to look the people down, look sides, so the eyes, all of those ones. So you are training the muscles, all of that.
Okay. So you can do that just sitting down.
On your
just,
own, you can just do
casually,
that. You can do that. One of the things too, we quite encourage people to do is just do some, you once in a while you just do a little massage on your eye, little massage. Yes,
I think I need some.
So they're quite good too.
Yeah, okay.
They're quite good,
Okay, so eye exercises, just the
good.
ones we've shown, they are good, Sitting close to television damages
It's not good. It's not good.
Yeah.
When that's what a parents, not just parents, anybody, uncle, auntie, was very observant.
Yeah.
You notice that a child, anytime wants to, have to come close to the
Could
television.
be a significant.
It could be that maybe this person, he doesn't say things that are far. Say myope.
Okay.
So you have to. So go see your doctor, your eye doctor, let him treat you. The same thing with aunties and the teachers, that great profession, the teachers.
The teachers, yes.
When in class you observe and they find that, this pupil or this student, he wants to copy anything on the board, he has to go too close. Or he says, no, I need to sit in front. There's an eye issue.
Okay.
So let's find out what the eye problem is. Is it a refractive problem? Is it a disease issue? Whatever it is, let's be able to address it as quickly as possible.
Okay, so watching TV too close is not
advisable.
But if you find your child or a student of yours trying to come too close,
advise the person to go to the hospital.
Advise properly. Now, reading under dim lights, the light is not.
Yeah.
There's one that I experienced. When you look at your phone and the light is off, and by the time you take your phone off your eyes, you feel this weakness.
Yeah.
I suppose that's not.
It's not good.
It's not good.
It's not good because you see,
So
there is what we call standard illumination.
Okay.
Standard illumination. That the amount of light that should be in a room when you want to read, that will help not to put strain on the eye.
Okay.
Once the environment is properly illuminated, you've reduced the amount of strain in the eye.
Okay.
Once the illumination is low, you are putting up strain on the eye.
Okay.
Because the eye needs to be able to see the prints and
clearly.
Yes, clearly.
Okay. Then drinking Gary. Damages it. That story is ringing in my head every day. If you drink Gary too much, to spoil your eye.
No, there's no correlation for that.
Okay.
It's just that when they have people say, no, he drank so much Gary. That's why the eye. We've been hearing that even when we're in boarding school. There's nothing like drinking Gary will spoil the eye. If drinking Gary spoil that means many people would have been blind. No, it has nothing to do with the eye defect. Drinking Gary is not the cause.
Okay.
You tell the do exercises. It's not an issue. No.
And then pouring things into the eye like palm wine, breast milk, all of that.
Permit me to say something.
Okay.
A couple of years ago, I was doing my youth service in Borno State. I shed tears. I was sent to a hospital that is a border town, Gambrungala. That's Nguru axis, a border town to Chad.
Okay.
As a copper, they didn't have an eye unit. I was in charge of the eye unit in Nguru. Present day, it now became, fell under Yobe State.
Okay, we're wrapping up now.
Yes, all the And every time I come to the hospital in the morning, all the babies they will bring, they will all be blind. All. So, and I felt, looking at where I was coming from, I felt so bad. Each time the door I opened, they were all blind. So when I asked the nurse who was working, I said, why? He said, yeah, there is something they do here that from where they're coming from. When they give birth to the baby, and then there is discharge, a little discharge, that they take teaspoonful, put red oil, put onion, and then they heat it on fire and drop it on the eye. So imagine hot oil with onion. So once you drop it, it will burn off.
Burn off, of course.
So they do it. When the thing is now burnt off, they bring the child to the hospital. So part of the thing that I did was to go now to that area, yes, as part of my youth service, to begin to speak to them. No, stop doing it. So that's so let me tell you. So the point I'm making is this issue of putting oil or putting onions or putting breast milk. They say, if you put the breast, the baby's eye, say there is a child, you say put breast milk on it. It's wrong. Wow. The breast milk is not a topical antibiotics. To put in the eye.
Breastfeed the child.
Breastfeed the child. When the eye have a child, everything, take the child to the hospital so the child be treated. You don't need to put any breast milk. Some say put urine. We've had that. We'll see it in the hospital regularly. Say no, put urine. Oh, force urine in the morning, put it in the eye. The eye will say none of these things should be. The eye is so delicate
so
that you shouldn't put any of these things to the eye. Be careful how you manage your eye. Don't put anything into the eye. Yes. You have any eye problem, go to the hospital and let the doctor assess your eye, treat you, so you can enjoy your eye all through your life to the day God will call you.
Thank you very much, sir. I'm even cringing at the urine idea. I'm just cringing at it.
We'll see you regularly in the hospital.
Thank you.
A lot of enlightenment and all that will help.
Yes, and I hope it has really helped a lot of people that are watched today. Thank you so much for coming on the program. I wish I could talk more, but I'll need to bring you back.
That's okay.
I'll pull you back here so that we can
talk
much on that. Thank you so much.
Thank you.
And thank you, viewers, for staying with us for the past couple of minutes. I've been speaking to Venerable Dr. Louis Oche. He's an optometrist with the Health and Human Services Secretariat at the Federal Capital Development Authority, Abuja. And I hope you've learned a lot for today. I'll see you next week. Goodbye. My name is Angela Weze.